Thanks, listeners, for joining us for today's edition of Wellness Wednesday, brought to you by Vitality Unlimited, certified community behavioral health clinics. And my guest today is clinical supervisor, licensed clinical social worker, Heather D'Angeli, and she is with the Carson City office of the CCBHC for Vitality Unlimited. Heather, welcome to our radio show, and thanks for taking time out of your really busy schedule.
Oh, it's my pleasure to be here.
So what we want to talk about with you today, being the clinical supervisor, is that Vitality Unlimited is able to offer some real cutting-edge therapy. If you wouldn't mind talking about what that means to families and individuals who are looking for the best services.
Yeah, so one of the goals, especially for me as a clinical supervisor, is to ensure that we're providing top-notch clinical care to rural areas. Just because you live in a rural area doesn't mean you aren't entitled to having, again, that top-notch clinical care. So Vitality is really committed to providing those cutting-edge therapies. They invest in their clinicians just as their clinicians invest in our consumers. And so we provide a large array of different therapies. We do, and a lot of these are acronyms, so nobody has to really remember the big fancy name. They can just remember those 3 little letters or 4 little letters. Google those, and a ton of information comes up. But 2 of the most innovative therapies that we currently offer are DBT, which stands for Dialectical Behavioral Therapy, and EMDR, which is eye movement desensitization reprocessing. And those are, again, very big words that no one has to remember. But DBT is a really great skills-based therapy that helps give people specific coping skills and tools to use when they're struggling in various areas of life. And the EMDR is a really great trauma therapy. It's now being used a lot with our veterans. The United States military has been supporting this therapy for years, and it's a really innovative way to process that trauma through the brain. It's very science-based, and then back out so that people are no longer experiencing those symptoms of trauma.
Well, that's terrific news, especially for people, as you mentioned, Heather, who are in rural communities like ours. Vitality Unlimited serves in Carson City and Elko as well, and other outlying communities, and that connection is growing stronger, I think, with every passing week. It helps people change their negative thinking patterns, right?
Yeah, absolutely. So it was originally developed back in the 80s by a woman named Marsha Linehan. And I was really blessed to actually be trained in DBT by one of her cohorts, Dr. Alan Frazzetti from the University of Nevada, Reno. And DBT was originally developed specifically for those experiencing borderline personality disorder. Once it was developed and they were doing the clinical trials on the effectiveness of this therapy, they found that it was so effective with this population. They wondered, could we apply this therapy technique to various diagnoses? And when they did that, they found equal, if not even more success applying this to things like depression, anxiety, obsessive thinking patterns, relationship issues, communication and attachment issues. And so it's now one of the most widely used therapies. It can be difficult to find, especially in rural areas, but we have several licensed DBT clinicians with Vitality, so that's a really huge plus. And so DBT, like I said, is very skills-based. So it's broken down into 4 groups of skills. So you're going to learn mindfulness, you're going to learn emotion regulation, you're going to learn interpersonal effectiveness, and distress tolerance skills. And so each of those sections has like a dozen or so skills underneath, and you will get to learn how to use those skills for different areas of your life. Mindfulness is really great for anxiety and depression. Emotion regulation is really great for regulating your emotions on a daily basis, something that's more consistent that you do every day. Interpersonal effectiveness is really great for communication, building and keeping relationships, and distress tolerance is really great for those crisis situations when you're in a crisis, you don't know what to do, and you need something immediately to help.
Heather, thank you so much. This is so encouraging, and I know it's just brief in a nutshell, but people might get the idea, and then they can call for services in our community, our very own CCBHC with Vitality Unlimited here in Elko, the VIPs, 777-8477. They can do that, and you emphasize helping people with chronic suicidality, substance abuse, PTSD, anxiety, depression, and intense emotion dysregulation.
And one of the cutting edge therapies that we're using for trauma, this is a really new one. I mean, it's not super new to the scene, but very new to insurance companies acknowledging the power of this type of therapy. So trauma is a great specialty of mine and something that Vitality really looks to help heal in our community. EMDR it's an intensive therapy, so actually all of our clinicians who practice EMDR go through over 20 hours of intense clinical training and have to be actually certified and undergo consultation and supervision in order to practice this type of therapy. This is something that's extremely hard to even find in rural areas, or in urban areas. So finding it in a rural area, such as our communities, is really something novel and new. So we're really enjoying this type of therapy and being able to offer it, but it's extremely science-based, and trauma really is. So trauma impacts the brain. It impacts the way the brain functions. It impacts the way the brain communicates with itself in different parts of the brain. They've done a ton of studies, and they're actually doing like MRIs, these brain scans on people who are experiencing PTSD, and the way that their brain works is actually totally different. And so this type of therapy is very science-based, and through some experiential exercises and 8 different phases of this therapy, so it's a long one, you actually get a chance to reprocess those traumatic memories and process them in a way that your brain no longer has to hold on to them. There are a lot of symptoms of PTSD that are very intrusive, those nightmares, those flashbacks, anxiety attacks, things of that nature. And so this therapy works to eliminate those symptoms through processing that event in a different way that your brain can understand, and then letting it go so that these things are no longer impacting your day. This is a therapy that the Veterans Association has really, really taken to with their military, and they've seen a huge decrease in suicidality related to PTSD, and so we're very happy to offer this service.
That could be really hopeful to families or individuals.
Yeah, absolutely. And this type of therapy is a type of therapy that you really build a strong rapport with your therapist with. You build a really strong connection. And so you're doing this type of work with somebody who feels safe, somebody that you trust. And it's great to know that your therapist is certified in this therapy and just isn't making something up. So you know you can go in there and get the care that you need and deserve.
Heather, thank you so much. Heather D'Angeli is a clinical supervisor for Certified Community Behavioral Health Clinic Vitality Unlimited in our community. If you're seeking services, if you need more information, would like a consultation, 777-8477. Heather, I know you talked about your commitment and dedication, and not just for individuals, but our local CCBHC is helping families and people in all kinds of situations, I understand.
Yes, we do offer some of these individualized types of therapies for individual sessions, but we aren't just treating mental health, right? We're treating co-occurring disorders. We're also treating substance use. So we're, really aiming to provide a variety of resources to our community. We also provide a variety of groups. We have peer support groups for being in recovery. We have DBT groups, right? So if you want to just come to a group and get some of those skills, you can. We have some teen groups for teen support. We have some groups for our LGBTQ community, and we also have family therapy and marriage counseling. So we're looking to serve our consumers as a whole, right? They're not just coming in as an individual person. They have families, they have relationships, they have more than just one need. And so we're really working to serve all of those needs in the individual in one location.
We understand, too, at Vitality Center, both in Elko and Vitality Carson City, these treatment plans, these are not cookie cutter. They're personalized treatment plans, right, that could offer assistance or insight into a variety of problems or co-occurring problems, as you described.
Yeah, absolutely. We really focus on person-centered treatment. So the person comes in and we identify all of their needs and throughout their entire life. And so then they can kind of build their program to fit their current needs. They may start off saying, I need some case management individual therapy. And through individual therapy say, I think I need group and I might need some family counseling. And then we can keep building their program and evolving their program as the person evolves and grows throughout treatment.
And we've seen through COVID-19, Heather, sadly, that there are some critical needs, right? And we do know that medical personnel and trained staff are available 24 hours a day?
Yes, absolutely 24 hours a day. We do have a crisis call line, and that is, like you said, 24 hours a day, 7 days a week. You are able to contact any one of our therapists. We're on a rotating schedule and get that support you may need in a crisis. We have seen an increase due to COVID-19, but we've also worked diligently to stay open throughout the entire pandemic for in-person services as needed. And, we've really just worked to be there for our community and serve any of the needs they may have.
Heather, thank you so much for, again, taking time to visit with us on our Wellness Wednesday, which is sponsored by Vitality Unlimited, Certified Community Behavioral Health Clinic. You are the clinical supervisor for the organization, and we appreciate you sharing, obviously, your knowledge and your passion for what you do in treating populations, especially in rural Nevada. Thank you, Heather, for being our guest today.
Thanks. It was so great sharing with you all.